Good morning to Dr. Karina. Today we will present about a topic which is the determinations of occupational stress on workforce performance in the health industry in Malaysia. Group member have me, Bong Heng at 3392 and Kimberly, Isabel, Liao, Tintin at 4245. Background: the main focus in the high level of occupational stress faced by healthcare workers in Malaysia. Health industry is impact on their mental and physical health, and the subsequent effect on the industry overall efficiency and service quality. The study aimed to identify the determinants of this stress to develop efficient intervention strategy, enhance job performance, and promote the suitable development of the industry.
The ideal healthcare situation in Malaysia includes affordability and accessibility to medical treatments, using digital healthcare instruments to be renowned as a digital healthcare provider, and fostering a zero-stress workplace environment. However, the healthcare workforce in Malaysia experiences severe occupational stress due to disparities in salaries, gender-based unequal workplace treatments, and insufficient assistance. This scenario leads to medical errors which cause critical health conditions and reputational damage, reduced patient satisfaction due to increased waiting times, job burnout that causes increased turnover in pensions, and occupational stress that disrupt healthcare operations. Existing research studies are outdated and lack comprehensive analysis in the Malaysian context, where this study serves as a revised study to examine the determinants of occupational stress on workforce performance in the health industry in Malaysia.
General objective: to investigate the determinant of occupational stress of workforce performance in the healthy industry in Malaysia. Research questions: do healthy professional shortage demonstrate a significant relationship with workforce performance in the healthy industry in Malaysia? Question 2. Those workplace environments demonstrate a significant relationship with workforce performance in the healthy industry in Malaysia? And last question, do inadequate workplace benefits demonstrate a significant relationship with workforce performance in the healthy industry in Malaysia?
Several underpinning theories help to explore the theoretical frameworks within the context of the Malaysian healthcare workforce who experiences occupational stress. Human capital theory underscores the significance of investing in continuous learning and skill development opportunities among healthcare professionals, allowing the latest knowledge and right allocation among healthcare providers. Social exchange theory highlights that a low perception of workplace benefits versus costs influences workforce performance, whereby a positive Malaysian healthcare working environment increases motivation and medical performance. Social support theory emphasizes the role of social support through cultivating effective communication and fostering a culture of respect to promote positive and clear communication that combat Malaysian workplace bullying. Equity theory focuses on the importance of fairness in organizational practices, highlighting transparency and equal allocation of workplace benefits that support the initiatives of Malaysian Medics International in fostering an open healthcare environment.
Conceptual from roles: independent variable, healthcare professional shortage, workplace environment, unique workplace benefits, dependent variable, workforce performance. Theories underpinning the study: human capital theory address healthcare professional shortage by emphasizing investment in upskilling and reskilling program to enhance job performance. Social exchange theory and social support theory address the workplace environment by promoting physiology and physical factors, including encouragement and equal healthcare facility to improve workplace wellness. For hypothesis developments: healthcare professional shortage and workforce performance. High turnover rate and long working hours contribute to workforce shortage. For second is workplace environment and workforce performance. Toxic workplace environment including bullying and lack of transparency reduce workplace performance. For last is unequal workplace benefits and workforce performance. Disparities in pay and workforce advantage between different groups. For example, is private BS, public sector or gender, reduce working associate and performance.
Healthcare professional shortages happen due to high turnover rates from experiencing long working hours and overwhelming workloads that cause physical and mental exhaustion and reduce quality of medical delivery. Additionally, uneven workforce distribution between urban and rural areas hinders the accessibility of medical treatment. Job mismatch also leads to significant occupational stress as the workforce lacks the necessary skills and qualifications for their roles and stagnant career progression, demotivating healthcare professionals and causing diminished overall job performance. Therefore, the first hypothesis in this study demonstrates that healthcare professional shortages have a significant influence on the workforce performance in the health industry in Malaysia. The workplace environment in the Malaysian health industry also impacts healthcare workforce performance. This statement is supported by workplace bullying among senior doctors and housemen, leading to reduced workforce morale and psychological distress among junior doctors. Additionally, insufficient and outdated healthcare facilities in the Malaysian health industry hinder healthcare efficiency, effectiveness, and quality due to the reliance on manual operational practices and a lack of digital healthcare tools that burden the healthcare workers to provide optimal medical treatment. Therefore, the second hypothesis in this study demonstrates that the workplace environment has a significant influence on the workforce performance in the health industry in Malaysia. The Malaysia health industry faces challenges related to unequal workplace benefits, including disparities in salaries between the healthcare workers in public hospitals and those in private healthcare institutions, creating a feeling of injustice and demotivation. Disparities in workplace advantages among contract and permanent doctors also reduce job satisfaction. These disparities cause high turnover rates as healthcare professionals seek better opportunities abroad, losing skilled workforce and affecting organizational performance. Therefore, the third hypothesis in this study demonstrates that unequal workplace benefits have a significant influence on the workforce performance in the health industry in Malaysia.
Research design. This study adopts a mixed method research strategy by employing a quantitative and qualitative approach to collect numerical data and examine patterns. This study employs a descriptive research design aiming to explore, describe, and improve understanding of the impact of determinants of occupational stress on workforce performance in the health industry in Malaysia. The research strategy includes survey research, task structure, questions observed of workplace behavior, and secondary data analysis from literature review and government reports. The extent of research interference in minimal, ensuring naturalistic data collections within a country setting where conditions are controlled to some extent of facilitated observations. This study will adopt a longitudinal study design, collecting data over an extended period within a 3-month period to observe challenge and trend in job stress and workforce performance among healthcare professionals.
The population for this study consists of healthcare workers in Malaysia, focusing on those experiencing occupational stress and its impact on workforce performance. A sample of 100 healthcare workers was selected using a judgmental sampling technique, followed by a stratified random sampling technique, ensuring an unbiased and representative subset. The sample size was determined based on the guidelines requiring a minimum of active respondents to achieve a 95% of confidence level. The unit of analysis for this study is at the individual level, with data collected from healthcare workers demonstrating significant impacts on job performance due to occupational stress. This study employs a well-structured questionnaire to measure constructs related to the determinants of occupational stress and workforce performance among Malaysian healthcare workers. The questionnaire, developed based on well-defined research objectives and constructs, includes a demographic section, a section on occupational stress determinants, and a section on workforce performance. It uses dichotomous and multiple choice scales for demographics and a Likert scale to assess occupational stress impacts. The instrument was pre-tested and refined for reliability and validity through a pilot study and Chromebug Alpha for consistency. After ensuring reliability and validity, the final questionnaire was prepared for data collection from 100 healthcare workers, maintaining ethical considerations like confidentiality and the right to withdraw.
For data collection, this study employed both primary and secondary data source, where primary data source collect first-hand data of study-related individual, organization, and entities that provide new research insight without periods analysis, while the latter options data from readily available resource that enhance cost and time efficiency, provide large such data options from organizations, and enhance the investigations of change over time. Regarding the primary data source, this study employed to observe methods by observing and documenting the workplace behavior among Malaysian healthcare workers who demonstrates the influence of the determinants of occupational stress on their job's performance, where a period that suit its time horizons to select the related sample that generates the populations. This study also distribute questions to 100 Malaysian healthy workers to gather direct options related to the examined determinants of occupational stress that impact their medical performance. Regards the secondary data, this study assessed a published literature review including extensive academics, journal, and research articles to serve as evidence that can enhance the significance of the current research. This study also employs reports from the governments and industry such as the Ministry of Health to options database regards the workforce performance that is influenced by healthcare associates occupational stress and implement best practice in healthcare management across industry. Data analysis. Descriptive analysis summarizes aspects of a dataset by calculating mean, median, mode, standard deviation, range, and integrated range, providing a better understanding of the descriptions by data and center tendencies. Inferential analysis. Inferential analysis generates a population based on sample data. The apply inferential statistical approaches in the multi-regression analysis. Multi-regression analysis the relationship between a dependent variable and multiple independent variables that enable forecasting outcome and control variable, identifies significant predictor and facility model comparisons for accurate predictions, whereby it examines the relationship between workforce performance in the health system in Malaysia and operational stress, including healthcare performance shortage, workplace environment, and unique workplace benefits. The equations of multi-variable regression is represented as below, where Y represents the workforce performance in the health system in Malaysia. Beta 0 represents the value of Y when all independent variables are equal to 0. S1 represents healthcare professional shortage, X2 represents the workplace environment, and last X3 represent unique workplace benefits and represent error. That's all is our presentations. Thanks you for your time and watching.